Right. To make sense of where we are at the moment as far as our fight against COVID-19 is concerned, Dr. Praveen Chandra, Medanta Medicity Hospital joins us on the broadcast. Thanks so much, Dr. Chandra, for being with us. I want to begin by asking you, on a day when we should be celebrating the launch of the world's biggest vaccination drive, vaccinating all of those individuals above the age of 18, what we're essentially reporting is a shortage of vaccination from several states, only limited centers. It appears to be a token drive. Many states are not even attempting a rollout now. They say they'll delay it by a few days. How does this affect our fight against COVID at this crucial juncture?
I think, this is a very important aspect of actually controlling COVID in our country. Only two ways we can control. One is vaccination, and of course, when about 60% people will get affected or get diseased. So we don't want that second one. We want that people should get immunized and vaccinated as much as possible. And let me tell you, we started very well. In the initial first phase of vaccination, this was perfect. Everything was happening nicely and people got the vaccines. There was no shortage. But now in this rollout, I think we are a little bit messed up. And I must accept that this is not the way it should happen, because this will create a lot of confusion, lot of chaos, because if there is less vaccine and more people, of course there will be a issue and there can be commotion at those sites, and people will not be able to get it in a proper sense and proper way.
Right. There is also a sense of insecurity among those above the age of 45 who are due their second shot at the moment. What would you like to tell them? There have been a lot of questions on what happens if they don't get the second shot. We know in Mumbai, for instance, vaccination has stopped for a period of 3 days. What about those people who were scheduled to get their second shot in these 3 days? How much of a delay is okay?
There's no measure to the delay. Basically, it should be done, as I said, as soon as possible. But I must give a word of caution at this stage that do not create panic, do not cause panic, be more organized at all levels. For example, the patient should not start accumulating at those sites. They should not create a situation of confrontation with the health workers and also at the centers, so that everything gets disrupted. So I will suggest that people should be a little bit they should be having some sense that yes, this is the situation. They should take their time, and there's no panic. There's no panic at all. Be at home, use double masking and sanitization, and that's okay. It's all right.
Dr. Chandra, there are also questions on the precautions that one should follow when you go out to get yourself vaccinated. You are going to go to a vaccination site, which, very well could be a hospital. There will be other people over there as well. What are the precautions that one should take when you do go out to get yourself vaccinated?
Yes. So I think, this is a very important thing to understand, that if it is in a hospital or in a space where more people are there, then one should not try to just accumulate at one point and, get closer to each other. That distancing should maintain, and also do not remove the mask. That is the most important thing. People sometimes, when they are talking to the person on the counter, or they're talking to each other, they're just pulling the mask down and then they are talking. I mean, the whole thing is lost. So please do not remove the mask at any point in time. And let me give you an example. What is happening is that those people, those health workers who are working for the last 1.5 years, if they are not removing the mask during their entire stay in that area, nothing happens. So you can imagine. So it is absolutely safe. It's like a vaccination. So do not remove the mask while you are talking, or do not try to start having coffee and tea and things like that.
Yes. So I think it's very important advice that you're giving. You're saying that when you go out to get your vaccine, you have to remember that your mask is also like a vaccine and you must absolutely not remove it. Many doctors also advise to double mask. And while you're at a vaccination center, do not remove your mask and don't pull it down if if you're trying to have a conversation with somebody, it defeats the purpose. We also have Dr. S. Hiramat joining us. He's an ex-IMA president, director, Cath Labs. Thank you so much for being with us. You're joining us from Pune. What is the status of vaccine rollout? We know that Maharashtra is one of those states that's flagged a worrying shortage in vaccines. How does this affect the fight against the pandemic at a time when there are several places, worst affected places like Bombay, for instance, that are actually reporting a dip in positivity rate?
That's actually quite strange because Serum Institute is housed in Pune. We manufacture the vaccine for the entire world. In fact, they say that every third child born gets vaccinated by a Serum Institute vaccine. And in this town, we should face this kind of problem. So it's quite shocking to me why we run into this kind of situation. However, I think getting vaccine is perhaps very important. And then you keep a gap between first and second. The appropriate gap is still debated, but I would feel between second month and third month would be a good gap.
Right.
And once you take the second vaccine, you are still not 100% safe. I think you still need about 15 days to get a full immunity, and then you are probably quite safe.
Right. I also want to ask you, Doctor, at this point, there is, a lot of insecurity among patients about the second dose, and you've talked about this issue of dosing regimen being affected because of a shortage of vaccine supply. Many doctors have also said that it's actually okay to wait for a longer period of time because it increases the vaccine efficacy, both in Covishield and Covaxin. Would you agree?
Yeah, I mean, initially when I took the first vaccine, I was told to come after 4 weeks. In fact, 2-3 days before I actually completed 4 weeks.
Right.
However, in recent thinking, this 4 weeks has got extended to 8 weeks and 12 weeks. So somewhere between 8 and 12 weeks looks like the best timing.
Right. I want to ask you, Dr. Chandra, another follow-up question. There are many experts, public health experts, both in India and those who are watching the India story very closely from abroad, who suggest that it has to be a combination of vaccination as well as very strict public health measures like lockdowns that need to be put in place for us to be flattening the curve, for us to come out of this surge. Do you A, agree with that assessment, and B, do you feel enough is being done on the ground on both fronts?
So this is a very important point, and we have been discussing this as to what has been the cause or mechanism why all this happened. And of course, I don't want to get into controversies, but certainly this was multifactorial. And our country actually, did step into some fatal mistakes, I must say. And these mistakes are many, as you all know. I don't have to enumerate all of them. And now is the time that we start working in this direction. And I think, personally, I thought that we should have had a lockdown starting a little bit earlier than what we are thinking now. It is being done in bits and pieces. It should have been a complete lockdown. Nobody moves, and that would actually break the chain much faster. Because right now what is happening is there are lockdowns in some cities it is not. So mixing is still happening.
Absolutely. Dr. Chandra, Dr. Hiramat, would you agree with Dr. Chandra?
Well, I don't think I'm an expert in that area, but it's just common sense what Dr. Chandra is saying. That if you keep 2 neighboring towns, one lockdown, one open, obviously there is going to be a lot of mixing and it doesn't work. Yes.
All right. Well, thank you so much, doctors, for sparing your time this Saturday morning and joining us.